Hello everyone. This is Hannah Laurison from Change Lab Solutions. We're thrilled to have this call today to talk about how corner store advocates around the country are exploring how to work with local government to incentivize and sustain healthy changes in small stores. And what we're seeing is that in some communities, new policies are being developed. In other places, existing resources are really being creatively redirected to support healthy corner store work. So this webinar is really going to give an introduction to the local government partners who can support healthy corner store initiatives. We'll introduce you to the roles economic development, planning, and elected officials can play in this work. And we'll share some stories from places that have successfully used these tools to support small, healthy food stores in their communities. This is the first in a Healthy Corner Store webinar series we're calling New Carrots on the Block. If you haven't signed up for our upcoming webinars, the next one will focus on finding funding and other kinds of resources to support your work in small stores, followed by an overview of how to use certification programs to provide incentives to small store owners. So we hope you'll come back and join us for those calls where we'll get to dive in a little bit more deeper to those different topics. We're going to use the chat function to communicate with each other today. The chat function is located on the lower left-hand side of your screen. So just to warm up the chat box and make sure everyone can find it, why don't you locate the chat box and enter in, if you went into a corner store today after this webinar, what would you buy? And go ahead and enter that. So for the agenda for today's call, we're going to have a brief introduction to the kinds of partnerships for healthy corner stores. And then we're going to hear from an amazing group of individuals who I'll introduce in a moment from Baldwin Park in California, who are really working to transform using a lot of different strategies the small stores. Then I'll give more of a dive into some of the planning tools that can affect healthy corner stores. And then we'll have an opportunity to hear from community health councils in Los Angeles and the amazing work that they're doing in the whole food environment in Los Angeles. So we're really excited. So I'm watching your chats come in, and I'm impressed with the range of healthy options that you all are finding in your stores. You must be doing amazing work already. Many of you are buying fruit. I see some mangoes and bananas and apples, coconut water, some iced tea, some nuts. Oh, there's someone who's going to buy ice cream. That sounds a little bit more like the corner store in my neighborhood. So that's the chat box. We hope you'll use it to ask questions of any of the presenters throughout the call today. I wanted to take a moment to introduce Change Lab Solutions. We are formally known as Public Health Law and Policy. We're based in Oakland but work across the country to really use innovative law and policy tools to create healthy communities. And so today we're going to apply that to the small store environment and hopefully really help create a picture of what's possible, what you might be working towards. Today's webinar is sponsored by the Network for a Healthy California's retail program, which really provides many excellent tools and resources to help consumers, both to help consumers make healthy choices and also to support retailers in stocking more fruits and vegetables. And since this funding is California specific, our examples today will mostly come from the Golden State, but we know that some of you on the call work in other parts of the country, and if you'd like information about how those the local laws that we're talking about today apply in your community, please do be in touch after the webinar. And I actually wanted to mention that the Network for a Healthy California is putting on a really exciting conference in partnership with the California Tobacco Control Program called Healthy Retailers, Healthy Communities, which will take place September 13th and 14th in Sacramento. And the purpose of this conference is to explore the ways in which the retail environment can be used as a force to build healthier communities and neighborhoods by really integrating tobacco control, alcohol control, and promoting healthy food choices in the small store environment. So if you're not aware of it, I definitely would encourage any of you on the call to check that out. I think it's really a groundbreaking, sure to be a really groundbreaking event. So let me introduce the folks who will be speaking with you today. My name is Hannah Burton-Lorison, and I'm a senior planner here at Change Lab Solutions. And for almost 10 years, I've co-convened with the Community Food Security Coalition, the Food Trust, and Urbane Development, the Healthy Corner Stores Network, and in that capacity have gotten to support healthy corner store projects across the country. And this is a big passion for me, so I'm really excited to be on the call with all of you today. I'm joined by my colleague Lisa. Lisa Chen is a planner here at Change Lab Solutions, and she specializes in community food systems. Prior to joining Change Lab Solutions, she worked as an educator and a project manager at a variety of organizations focused on youth development, participatory urban planning, and sustainable food systems. And she holds a dual master's degree from UC Berkeley in city planning and public health. And then I'm most excited to introduce to you a really fantastic foursome. Christina Cardenas is with the California Center for Public Health Advocacy, and she's the regional advocacy manager there, coordinating grassroots community efforts towards healthy environments, of which corner stores are just one of her many hats. But she and her partners have developed really exciting healthy corner store programs in Baldwin Park, in El Monte, and a variety of other locations. She holds a BA in sociology from Cal State Northridge. She is joined by two of her partners. Councilwoman Marlene Garcia has been a member of the Baldwin Park City Council since November 1999, and she was the first Latina elected to the Baldwin Park City Council, which is fantastic. And I'm so honored that she's on the call today to describe the work that she's done to support healthy food access in Baldwin Park. Then I'd like to introduce you to Sal Lopez, who's a city planner with the City of Baldwin Park for more than 12 years. And it's always interesting when urban planners get together. I think Mr. Lopez is really extraordinary in his vision for how health and the built environment can work together through a variety of city departments to ensure that cities really get the benefits of long-term planning to address economic development challenges that affect public health and the built environment. And I wish all planners were as visionary as Mr. Lopez, so thank you for joining us on the call today. And then last but certainly not least, we're joined by Ms. Gwendolyn Flynn, who is the Community Health and Education Policy Director with the Community Health Councils, which is a really exciting nonprofit organization based in Los Angeles. She oversees the efforts to improve access to nutritious food and physical activity through changing institutional practices, promoting local investment, and really improving the existing infrastructure in South LA. And so she's going to speak really across a broad range of food access strategies, and we're thrilled to have her on the call today to bring that perspective. So we'd like to hear a little bit from you. We'd like to know where you are in your Healthy Corner Store work. Are you just starting out? Do you have a plan? Are you in the weeds with implementation? So go ahead and fill in your answers. We'd like to know so that we can address our remarks today to where you are in the field. And I'm watching the responses coming in, and it seems like most of you are in the early stages of planning, which is fantastic. I love that you're on the call today to get the perspective from folks who have been at it for many years. But it also sounds like we have some folks that are really in the thick of it. So I hope that you will talk back to us through the chat function and share any comments as well as your questions as we go through the content today. So again, really wanting to emphasize that the chat box is the place for you to share your experience, not just to ask questions, but also to contribute your perspective, and we'll feed that back and share that with the group. So I'd like to take a moment to actually acknowledge that we're talking about somewhat of strange bedfellows. Corner store owners and local governments aren't always used in the way, the partnership between corner store owners and local governments aren't always used in the way that we're going to talk about them today. And presumably you joined the call today because you think that something good could come out of a closer relationship between these two entities. But what do store owners in your community think of local government? And actually, if any of you if you've asked that question of your store owners or think you have an answer, I'd love for you to enter it in the chat box. I've done surveys of corner store owners in many different communities, and in my experience, store owners seem to think of local government as a source of bureaucratic inconvenience, costing them time, money, headaches. And to be fair, small businesses are subjected to many different government regulations. They need a permit from Public Health Department and a liquor sales license if they sell alcohol. They have to register with the state as a tobacco retailer, and they may need a local tobacco retail license. They're required to have a business permit. They need land use or zoning approval for their store. They may need a building permit to conduct renovation. And each of these permits carries with it a fee, might have training requirements, and takes up time. If they are inspected, they may be fined or shut down. And they may be unaware of some of the real resources, the technical assistance, possibly sources of funding that government does offer. So their attitude may be based in some reality, in their reality. So what do you think your local government views the corner stores, and how do you think the local government in your community today views corner stores? And there too, I think it varies. We're certainly going to hear from Baldwin Park, where I think they may have a non-typical attitude. I think in many communities, small stores are really viewed as sources of blight, contributing to littering, to loitering, and possibly to the sale of alcohol and tobacco to underage minors, to underage consumers. So your local government may not yet share your view of small stores as potentially positive contributors to community health and neighborhood economic sustainability. And I think for many reasons, most of them fiscal, or some of it may be having to do with just the status quo, local governments tend to concentrate their services and attention on businesses that employ large numbers of people or that contribute significantly to the local tax base, which may not be true of any individual corner store. And yet, corner stores are the most numerous, are more numerous than full-service supermarkets and other outlets we associate with healthy food, and they're a reality for most communities. So I guess that many of you on the call today are here because you believe that small stores have a role to play in healthy, vibrant communities. So what can be done? How do we bring those two worlds together? Let's find out. I'd like to hand the baton over to Lisa to introduce the types of partnerships that can support healthy corner stores.
Great. Thank you, Hannah, for that excellent description of some of the barriers that store owners and government agencies face in working with one another. Of that long list of regulations facing corner stores that you presented, it's important to note that many of these laws were created to protect public health, primarily food safety and public safety. So it definitely is within government's power and purpose to adopt policies that can improve health. And we'd like to see more governments doing that to increase access to healthy foods rather than just thinking about food safety and preventing access to unhealthy foods and products. Further, governments can adopt different roles when working with corner stores, providing support and working as a partner rather than just as a regulator. Today we'll be hearing from some case studies describing communities that have really worked to develop these collaborative working relationships between small store owners and local governments to create healthier corner stores. In these examples, public health and community-based organizations have really been instrumental in helping to bridge that divide between these diverse stakeholders. First, we just wanted to start so that we're all on the same page with a description of some of the partners who can really support healthy corner store initiatives. Community partners will probably be the group that most of you are most familiar with, whether you come from a public health agency or are working at a community-based organization yourself. In the context of a healthy corner store policy or program, food and hunger groups, neighborhood associations, faith-based institutions, youth development, and other community groups can lend credibility to the process by generating ideas and feedback and garnering community support. Gaining true buy-in from small store owners is critical to the sustainability of corner store initiatives. But there are many additional business partners who can lend expertise and resources. Business associations can be an especially useful way to gain feedback and strengthen outreach efforts, particularly if you're trying to reach store owners in a minority or ethnic community where linguistic or cultural or other barriers may make it more difficult to reach individual store owners. It may also be necessary to find food distributors who can supply healthy foods at appropriate quantities. And marketing and store consultants can provide additional expertise on how to make healthy changes fit within a sustainable business model. We'll be focusing today on some of the tools that governments have at their disposal to support healthy corner stores. Securing government support can truly help institutionalize healthy corner store initiatives and provide the momentum needed to really move them forward. Elected officials, planning departments, and economic development agencies all have existing tools that can be leveraged to promote healthy corner stores, in addition to more recent policy groups such as food policy councils or food access coalitions. Reiterating the idea that government agencies can really serve as partners to small store owners, we wanted to highlight some of the roles that policies and policymakers can play. Using policies that incentivize and encourage stores to provide healthier products may be the most inclusive approach to gaining support of store owners, particularly if there are attractive incentives available. For instance, small business development programs could be used to encourage corner stores to sell fruits and vegetables in exchange for loans, refrigeration equipment, or other assistance. One example of this is the Healthy Foods Here program, which is the one that is pictured from Seattle. However, where feasible, it may make sense to pair incentives with requirements and restrictions in order to achieve maximum impact on the larger food environment. For instance, a policy could require small stores to stock fresh fruits and vegetables, which is what Watsonville, California did in their recent zoning update. Similarly, a policy could restrict unwanted behavior, for example, limiting new liquor licenses in a particular neighborhood. Later we'll be hearing an example from community health councils in Los Angeles, which adopted a policy that banned new fast food stores in South LA, an area which is already disproportionately burdened by fast food restaurants. And just as important, we want to just really hone in on the more informal ways that policymakers can really help shape the retail environment. Policymakers can help champion a cause by helping move projects forward, educating others on issues of central importance, and ultimately helping make healthier choices the norm. So with that introduction, we really want to jump into our case study. We're going to be hearing today from Baldwin Park, where their Healthy Baldwin Park Corner Store initiative truly helped to change the landscape of food retailers in their community through a broad-based approach of incentives and policy tools. We'll be hearing today from 3 different perspectives. We're going to be joined by Christina Cardenas, who is the Regional Advocacy Manager for the California Center for Public Health Advocacy, Councilmember Marlene Garcia, and Associate Planner Sal Lopez. So we have some questions prepared for them, but I just want to take a moment to remind everyone out there to please use the chat function to send any questions that you come up with. And if we don't have a chance to answer them now, there's also going to be some Q&A time at the very end of the call where we'll be hearing from all of our speakers. So with that, we are so thrilled to be able to present 3 different perspectives on really this relationship that we're talking about, the one between the small store owners and the local government and larger community. As Hannah has mentioned, store owners really provide a service to the community, and so it really is in all of our best interest to make sure that they're really serving our interests by providing healthier foods so that people can make those healthy decisions. So to get started, I wanted to ask Christina to provide us a brief description of the Healthy Corner Store work that has happened in Baldwin Park.
Good afternoon, or good morning, everyone. Thanks so much for the introduction, and we're very happy to be part of this call today to talk locally and kind of share some of our best practices and how we came about to partner with the city to carry out the Healthy Selection Program. Just wanted to share a little bit about the organization I work for, the California Center for Public Health Advocacy. We conducted a study of food environments in California called Retail Food Access Study, which included all retail food outlets, which included fast food restaurants, corner stores, supermarkets, and produce vendors throughout California, and found that in 2005 the state had more than 4 times as many fast food restaurants and corner stores for every supermarket and produce vendor found. We found that in Baldwin Park particularly, there's 6 corner stores for every supermarket, and the incidence of obesity is among the highest in the San Gabriel Valley. So we really looked in our work as a collaborative, which is called People on the Move, we really looked at connecting with community members and really addressing healthy retail needs, but also addressing obesity rates. We really wanted to raise awareness and ensure that we developed a longer-term strategy with community and with local city to ensure that in these hard economic times that we looked at really developing communication and trust with corner store owners to support their economic success. And we were able to work with owners to identify their needs and barriers, which is crucial to kind of really gaining that trust and really gaining their input and buy-in into a citywide effort to support healthy retail development. You'll see some photos here of some of the initial assessments that we did conduct in corner stores. We started by conducting assessments of 17 corner stores within a 2-mile radius of schools. We looked at everything from marketing aspects, signage, product placement, items near the cash register, to really working with residents to talk about what are some tactics used in corner stores, such as eye-level marketing for youth. You can see here with all the candy display aisles and things that are at the eye level at the cash register, and some of the impulse buy and some of the kind of thoughts behind purchasing, and some of the things that some of the parents, we were able to discover some of the parents had to deal with in terms of what their children wanted and the pressures that they had. So through that experience, we were able to assess the types of products, the quantity of type of products, and then the quality of products. We also worked in this process to develop a corner store report, which basically captured all the data that was collected from the corner stores, presented to City Council, presented to the corner stores themselves, to really kind of share, and here's some photos of some of the residents and some of the clipboards and audits that they conducted, to share 2 things. The conditions of the stores. We were able to actually interview customers within the stores to find out what were some items that they saw as things that they would like to come back for in the stores. So not only did we capture the quality and content of the stores, but what customers in Baldwin Park wanted to see at the corner stores. And we're able to develop corner store profiles for each store so they could see what it was that was the observations made about their store, and then the items and room for growth that the corner stores could make. We were able to really kind of point out and really capture data on the things that we do know, which is that 80% of the products displayed at the cash register were sweetened drinks, cookies, cakes, candies, and only 20% of the products were considered a healthy choice. So we immediately looked at the cash register area as a great opportunity for really promoting healthier products. We also looked at produce areas and some opportunities for preparing and designing collateral that could really promote healthier items in the store. So the next thing that we did is we worked with a nutritionist to develop the requirements for the tagging of products through a Healthy Selection logo, which you saw there's a slide previous where there was a butterfly and a Healthy Selection logo. That was the logo developed by youth, and as you can see here, it's a little more prevalent. And it does allow for shelves to really display specifically products lower in fat, sugar, salt content that was designated by a nutritionist. So that was done to, we ended up with, started with 7 pilot stores and expanded to 14. And the opportunity allowed us to really scratch the surface with corner store owners in developing a community-city partnership, which we'll discuss a little more with our leaders here in Baldwin Park, but really allowed us to connect with community, to create, think creatively of how we can work not only with residents to provide education and awareness, but to really provide the resources for corner stores. And some of those resources ended up being support in becoming WIC certified. So we worked with 3 stores to expand their offerings through WIC certification. We also connected, as you can see here, as displayed on the window signage. We also were able to provide TA and support to corner stores to find wholesale resources such as Unified Grocers, who recently expanded their program to include a neighborhood market component, which previously was only, so it's a wholesale purchasing opportunity for corner stores that has traditionally only been available to large chains. So these types of resources that that were now available were things that we were able to provide to the corner store owners and support them in having Unified Grocers actually come and do a site visit in Baldwin Park to all the corner stores to really extend their hand and really share this new opportunity for corner stores. And you'll see here there's a photo now of some ideas that residents really talked about. So all the stores receive baskets, really simple, low-cost ideas for bringing healthier products that don't require refrigeration to either the cash register or places where youth, eye-level areas where youth could access healthier choices. We also worked with, on the next slide you'll see, is marketing, on the slide after, marketing tactics for store owners, such as hanging signage in the produce area, developing demos, displays. So this one in particular is a fat display that shows kind of the amount of fat content in certain products. And the store owners are really gracious to allow us to really provide consumer education and also to do some taste testing, which we worked with the Network for Healthy California to do tastings in Vallarta, some of our larger markets in the city. And this fall we're going to be doing tastings at our smaller corner stores as well to provide the opportunity for menus and different menus to be shared with the community, but also for the community to taste and try the menus in the store or recipes in the store.
Great. Thank you so much, Christina. That was really an excellent description of the kind of range of strategies that you and your partners adopted to work with store owners through not only distribution challenges, but also thinking about marketing, and then also really starting with a strong foundation in assessment, which I think is something that is going to be really appealing for a lot of our health partners out there in the audience. And it sounds like it was, for you, a really great way of bringing in different stakeholders and helping them learn about the issues in their local stores. We did have a question from the one of the audience members about which assessment tool you used during your early stages.
So we actually developed an assessment tool. We worked with our funder at the time. So we initially developed the tool with funding from the Healthy Eating Active Communities Initiative. So we worked with one of our local health department partners to develop the pre-survey, the assessment tool, as well as the database for entering, generating the final report. We are also currently in the fall going to be we're going to be doing a post-assessment. So that tool will be also used to assess kind of from the initial pilot stores to assess kind of where the stores are at, how they've progressed in terms of the access, the quality, and the initial recommendations that we had.
And are any of those resources available for others to learn from?
Sure, we do. We do have two tools. So one is for consumers, and then one is for just the physical attributes of the store itself.
Okay, great. So we'll connect with you and make sure that we send that out to people on the call so that they can also take a look. Great, thank you.
Sure.
So we're going to switch gears now, and I wanted to see if Councilmember Garcia and Saul, are you on the? Is your sound on? Just want to make sure that everyone can hear you. Okay, yes. And we've also gotten a request. Hello, good morning. We've also gotten a request from the audience that everyone just enunciate a little bit more. I think there's a little bit of background noise on the call, so we'll try to make sure everyone is heard loud and clear. I'm going to start by asking Councilmember Garcia, if you could please just provide us with some context for why this work was really needed in your community, and at what point you really got involved in the process and decided that it was important to work with local corner stores.
Yes, good morning, and thank you for inviting me to this conference. Actually, our work started many years ago. I want to say initially back in 2000, and for the corner store conversions, we started our work probably in 2005 through our HEAC collaborative. The corner store conversion was one of the components of the program, and we felt it important based on the statistics that we had, the data that we had on our youth being overweight and obese. And so we looked at the environment and we realized that we had more corner stores versus full-service supermarkets. And these corner stores are a vital component to the community. And we needed to reach out to them to see what they were providing to our community at large. A lot of our residents lack transportation and rely on these corner stores to purchase their produce. So we, through our resident advisory committee and our teams, we figured these are the consumers, these are the individuals that need to get involved in this process, and they were trained and educated on how to go out and assess these corner stores, and they had the opportunity to go out there and meet with the owners of the corner stores and introduce themselves. And our teens, as you see here, the logo, the Healthy Selections logo, was created by one of our teens. So we felt it important to have the buy-in and the participation of the community to also link that with our local corner stores, our business owners. As was mentioned earlier in the presentation here, the business owners don't have a strong working relationship with local municipalities, and so we felt this was a great opportunity for us to build that bridge and start working with our corner store owners and managers. And so what we did is the mayor and I would go out personally, would take time off of work and go out and visit these corner stores and meet with the owners and introduce the program that we are trying to promote, and let them know that we're here to work with them, to be a partner with them, to create a healthier environment for our youth and our families, and so that way they knew that we were really, really serious about this program, serious about making changes in our community, and so they were really happy to see us out there, and so we started building those bridges and that connection with the business owners. We incentivized the program for them by promoting their business through our local newspaper, and also bringing them to our different events and introducing them to our community, letting our community know that these are the business owners who are participating in our program, so that again, it gives them the advertisement that they seek, and so it's been a program that has been well received by our community, and we're very proud. So yes, as far as elected officials, we did get deeply involved in this whole process, and we've been working on it for years, and it is again a process that it takes time. But as long as municipalities, cities are diligent about it, these changes can be made.
Great, thank you so much. It was really, it sounds like it was a very inspiring way of bringing on small store owners, for them to see you out in the field, talking about these issues and really reiterating the fact that you wanted to partner with them. So Saul, thank you again for joining us. Could you just
Thank you for having me.
Oh, thank you. So could you just describe your kind of role as a planner in moving this work forward and how you got interested in really the issues facing corner stores?
Well, thank you. Christina and Councilwoman did cover some of the issues that I was going to speak about, but I also just wanted to reiterate that health is how we do business here in Baldwin Park, and whether it be our corner store program or smoke-free policies or our commitment to complete streets, we know that complete streets is a policy that would ensure that our people who walk to these corner stores are accessing and getting to these stores in a safe and efficient way. So, also the fact that we have 6 unhealthy food outlets for every 1 healthy food outlet was a critical driver for us with this Healthy Corner Store program, and that health and equity were key drivers in terms of healthy food access. Here in Baldwin Park, our community is approximately 34% of our students are overweight and 65% are considered unfit. So as a planner, I knew the importance of improving our corner stores, which in turn can also have a positive effect on our built environment, not only our built environment but also our economic development as well. If these stores provide better access and availability of products, then that would result in our people continuing to shop in these corner stores and keep those sales tax in our community. In terms of the built environment, when these corner stores are ultimately successful, then these owners have better expendable income to make site and aesthetic improvements that they otherwise could not have made without this success. So those are just a few things. Go ahead. Sorry.
Great. No, that was just a really great summary of the many different ways that healthy corner stores can benefit the community. And it sounds like health really was a way to bring people together, and it's something that was very compelling for folks. And I hope that resonates with a lot of people on the call. So it sounds like you had a pretty broad-based partnership and kind of a range of strategies. I was hoping that maybe you could speak a little bit about kind of what types of resources really government can bring to the table, and whether or not you felt like you were able to use different tools such as incentives or other policy tools in order to support this work.
Absolutely. We provide resources to these corner stores. We provide them resources such as the United Grocers. They have a corner store program. Other resources that we provide are the availability of our commercial loan program and incentives, such as acknowledging them in our city newsletter. Also, as the council member talked about, acknowledging all the good work and the impact these stores have made at our concerts in the park, free advertising in our newsletter, and identifying these stores as a healthy partner here in our community.
And Councilmember Garcia, did you want to add anything to that?
I just saw the question on what types of events were owners invited to for exposure, and we have a very, very successful Concerts in the Park program here in our city, and what we did is we brought these stores out to our concerts, and during the intermission of our event, we would bring up the business owners and introduce them to the community. We usually have about 2,000 people attend these events, and so we introduce these business owners to the community and acknowledge them for their partnership with us. And as I mentioned earlier, we also we provided them with a plaque for their participation and asked our residents to please shop at their stores because of the partnership we've established with them through this program, and also the promotion in our local paper that is delivered through every household here in the city of Baldwin Park. So this is big for them. It's a cost savings for them in terms of advertising, and again, having a sign at their main entrance to identify them as a store that promotes the Healthy Selection program.
Great. So I just have one final question, and then we're going to switch gears. So we've been talking a lot about successes, and I just wanted to ask if there were any big barriers or challenges that came up during the course of this work, and whether or not really having this broad set of partners was helpful in overcoming some of these challenges.
In terms of planning and some of the incentives, there's been a challenge with these corner stores. They do want to be involved, and they care about providing the healthy access to their customers. But when it comes down to making sure that these customers want to actually shop at their store to make it more aesthetically pleasing, they don't own their property, so they think twice about paying for those improvements to fix the facade or add better and nicer signage. There's just no support from the property owner with their desire to make things better, and the fact that they just don't own the property and they can't afford to invest in a property that's not theirs.
I think that's a really salient challenge that people may be encountering in their own situations as well. Did anyone else want to add to that? Councilmember Garcia or Christina?
I think for the City Council, we really didn't experience any challenges. I think more than anything, it opened the door for that relationship with these business owners that normally doesn't exist. They have this perception that government is trying to control their sales and their whole business, and it wasn't about that. We thank them for choosing to establish their business here in the city of Baldwin Park, and express to them our desire to make their business successful and promoting our program. Now, we didn't tell them to remove any of the unhealthy items. We asked them just to highlight, if they will, and provide healthier options in their stores, so that at least our community, when they would shop at their business, they would be informed as to what is healthier as a choice. And so again, it provides our residents with an option. As far as again, with the promotion of their business and allowing them to come to our events and speak to the audience, I think again it speaks volumes of the relationship that we want to build with our corner stores, and that we know are important to our residents.
Great.
Just wanted to add as well. Just another thing that that was kind of echoed earlier was the limited resources that the corner stores. We interviewed talked to the owners. They weren't really aware of the Chamber of Commerce. They weren't really aware of some of the business support resources that that the city offered. So we're able to really provide a venue for these smaller corner stores to connect. And I think that's one of the biggest things that we've seen is that these smaller operators are operating with really limited capacity. They're sometimes the only ones in the store. They're there all day, and in terms of just resources that could easily be accessed, even things such as like Edison, like low-cost energy conservation, in their store, were things that we were able to kind of bring to the table, and things that we've learned about through the city, like things that are offered to the small business community. We're able to bring it to that select group of the corner store owner. And the other thing that we did notice is that in terms of the economy, most of the store owners are really have been hit hard, and they are really operating, have seen declines in just their general revenues. They're seeing the community members themselves purchasing things just for the day, not purchasing food for the week, but really coming in once once or twice a week, really picking up things for just like the next 2 days. And so really kind of seeing that, to see the overall impact from the recession and the unemployment rates in the city. So those are just some observations that we've seen that really directly impacts the corner store's ability to make the changes and really kind of be as savvy as they want to be.
And I see that we have some questions coming in from our audience about sustainability, and so maybe we can speak a little bit more about that during the Q&A at the end of the call. Thank you all again so much for sharing your expertise and your perspectives. We're going to go ahead and switch gears now and hear from Hannah about some of the basic policy tools in land use planning and economic development planning that corner store owners can tap into.
Thanks, Lisa. So Lisa provided an overview earlier this morning of how governments can incentivize and require or restrict how businesses operate, but how do they actually do that? I want to just take a brief dive into the policy tools of local government that can be applied to creating healthy food environments, and provide again an overview of who the relevant agencies and players are that you'll need to get to know in order to do this work locally. So there are quite a few really important local policy tools to be aware of, and there's a list of them on your screen. We're going to focus on the economic development tools in the webinar on August 6th, Green for Greens, and I've seen a few questions coming in over the chat about how do you finance these changes in a sustainable way, and that's exactly what we're going to focus on August 6th. So for this morning, I'm going to narrow the list down to talking about land use planning and licensing. And the reason that I wanted to focus on those two tools is I think that they really have a lot to offer to transforming the food retail environment. But I would say it's an emerging strategy. We are seeing some examples from around the country of how communities are using these kinds of policy approaches to supporting their healthy corner store work. And I wanted to give those of you on the call who are in the early stages of your work the big picture of where you might go with your work. And I think it's really important to say up front that understanding how these tools function is one important skill to have, but I think maybe an even more important one, and one that we'll talk about with Gwen Flynn in just a moment, is really the political context in which you do your work and the economic context. That is as important as understanding, I think, the wonky tools. Understanding how to navigate the political context is really equally important. It was so great to hear from the folks in Baldwin Park how they really engaged local elected officials, because local elected officials ultimately really direct the work of planning agencies, and planners themselves need to be engaged. And I think not all planners get this as well as Sal Lopez does. So your work may be cut out to figure out what the message is that really resonates with your elected officials, and to anticipate some of the pushback that they may have and some of the concerns that they may have about this work. So you all may be coming at this from a health perspective. That may not be the most resonant message for local electeds. It may be more about neighborhood revitalization and really creating strong communities, and possibly about strong local business. So there's different ways to message this work to help navigate that political environment. But I definitely wanted to emphasize that the tools are one thing, the politics are really something else. So in terms of tools, as I said, I wanted to spend a little bit of time on land use planning. And here in California, we were really fortunate to have a pretty powerful tool in general plans. In other parts of the country, this may be called a comprehensive plan. And this is really a blueprint that guides future policy and implementation strategies. So having health-oriented language in comprehensive or general plans is really a very upstream strategy that can sometimes, not that it is not itself politically controversial, but can be a great way to articulate a vision, perhaps in a way that may feel less politically threatening than changes to zoning. And zoning is really is fundamentally a regulatory tool that shapes the built environment. So all of us live and work and play in communities and may not have an awareness of the way zoning has helped create that communities, but zoning is why we live in neighborhoods surrounded by houses as opposed to surrounded by factories, why we may have to drive somewhere to go shop as opposed to finding stores in our neighborhood. That's under all of those land use decisions is zoning. Zoning says what can be built and what kinds of activities can take place on a given property. So just as an overview, the comprehensive plan, it provides the large overarching goal of the community, and then zoning is much more specific, controlling the standards for buildings and other community infrastructure must conform to and what can take place in a given zone. So what does this look like on the ground? Here's an example from Watsonville, California that said in their general plan, we want to promote healthy neighborhoods by encouraging neighborhood convenience stores to carry healthy food such as fresh fruits and vegetables. Sounds pretty good. And they went on to provide a specific, concrete strategy for implementing that. And they said that at the time of development review, neighborhood markets would be required to incorporate the sale of fresh fruits and vegetables. So that's an interesting point about zoning. Zoning regulates the use of the land, and it applies to the piece of the land, even if the business changes hands, which might be very attractive for small store work where the business may, over time, work with different operators. Zoning, however, is prospective, applying to new businesses. So another really important tool to have in your bag of tricks is licensing. And licensing is distinct from land use planning because it is used to regulate how a business operates. And businesses are required by their local government to have a license that governs who can do business, where they can be located, the kinds of conditions that must be met, and how conditions will be enforced. So a license generally expires after a fixed term, or it can terminate after if it's not used for a specific period of time. And licensing requirements usually apply to both existing and new businesses. So what does that mean for corner stores? A license could be used to require stores to accept food stamps, EBT. It could be used to carry certain types of products like low-fat milk or produce or whole grains. And we recently developed a model licensing ordinance for healthy food retailers based by an existing ordinance that's been in operation in the city of Minneapolis for about 4 years now. They call it their Staple Foods Ordinance. And this tool basically requires store owners, anyone doing business as a food retailer, to carry a minimum selection of healthy foods and provides incentives for stores that want to go beyond. And again, for those of you who are really interested in the incentive-based approach, I strongly encourage you to attend the upcoming 2 webinars in this series, because we'll really talk about how incentive approaches can go hand in hand with a regulatory approach in a lot more detail. And I wanted to emphasize finally that policy is really just a starting point, that implementation and enforcement are really just as critical. Those of us working in California are all operating in communities governed by the Lee Law. And for those of you that aren't familiar with the Lee Law, you may be surprised to hear that there is this rule because it's very often very poorly enforced. The Lee Law says that no more than 33% of windows on a business may be covered with advertising. And I think the image that you see in this picture is probably representative of many stores in your communities where, well, I don't even know if it's 33% that's not covered. So this store is in violation of the Lee Law, but is lacking the enforcement mechanism to this law has not been enforced adequately in this community. And I think that harkens back to the point that I made at the beginning, that having the political will to enforce laws is again, another very important tool to have in your basket. So I'd like to invite Gwen to unmute her line and participate in a conversation about her work in Los Angeles. And we're so excited to have her on the call because she's really working at the intersection of a number of different food retail strategies. And Gwen, just to introduce, if you could briefly give that overview and describe the food retail initiatives that CHC is working on.
Okay, can you hear me?
Yes, I can.
Oh, good. Okay. So thank you, Hannah, for inviting us to participate, you and Lisa, on this call. Community Health Councils is focused on an area in Los Angeles known as South Los Angeles. It's also known as South Central Los Angeles, where quality food resources are inadequate and chronic diet-related diseases are disproportionately high. And so we've been working for a number of years, more than a decade, on ways to make the health outcomes improved a lot better, focused on nutrition and physical activities. And some of our initiatives that we are developing or have developed to improve access to nutrition as a means of addressing these chronic food-related diseases have been, let me just say that in the past we have worked in partnership with the California Endowment and other Unified Grocers and other partners in the establishment of the California Healthy Food Financing Initiative, the Fresh Works, that provides some funding for grocery stores and other food retail to come into underserved areas in California. And in addition to supporting initiatives that were started, I guess, under the now dismantled California or the Community Redevelopment Agency to support corner store conversions. We've worked with them as well, and now that's being undertaken by another agency that's being developed. And I know that the LA Food Policy Council has taken on some projects related to store conversions that we've been in support of. But in addition to that, we have a healthy food retail incentive program that we are promoting. It's designed to eliminate barriers and increase the economic viability of new grocery stores in underserved communities like South LA. It provides some regulatory relief and leverages existing federal, state, local, and private incentive programs to create a comprehensive incentive program that contributes to the economic development and help transform the food resource environment that ultimately we hope will improve the health of the community. And this initiative or this incentive program is actually an expansion of the Fresh and Healthy Food Enterprise Zones, which is one of the policy recommendations that we put forth in our Food Desert to Food Oasis brief of 2010. Another initiative that we are working on is the South LA Healthy Fast Food Incentive Program, which would allow fast food restaurants that desire to locate within restricted areas of South LA to receive an exemption from existing zoning restrictions based on compliance with incentive program guidelines. And those guidelines involve the expansion of menu offerings to include selections with high nutrient value. We're working to strengthen the current restrictions. The interim control ordinance that was to control the growth of fast food restaurants in South LA has matured to become an amendment to the general plan for the West Adams, Baldwin Hills, Leimert, just a section of South LA. And that amendment, we want to strengthen it to include all fast food restaurants, not just freestanding, which is how it stands now, and that the half-mile distance from other standalone restaurants also include places where children congregate, like schools and parks and rec facilities and public transit stops. So those are some of the food retail initiatives that CHC has been working on and is currently involved with.
That's a great overview. I'm very interested in hearing a little bit more about how you and your partners balance the types of positive, incentive-based approaches to the need for enforcement and a more regulatory approach. How do you navigate that politically? How do you decide when to use an incentive-based approach versus a regulatory approach? And how does the political context of LA influence your strategy selection?
Yes. So it's interesting. I mean, how do we balance the positive and the incentive with the other? It really is considering a number of different factors. I think for the most part, we are looking at several different factors, I guess I would say. We're examining the current policies and their impact as regards to food access, and for us it also includes opportunities to be active. Researching any comparable examples of proposed policy that might be out there, looking at the universe of activity that's going on where these issues are concerned, and I'm looking at regionally, statewide. You mentioned some activity going on in Watsonville, California, who have been really quite progressive in some of the policies that they're looking at. So looking at what's gone on broadly and what the possibilities might be for LA. Listening to the impact of community stakeholders, and then determining the window of opportunity given the political context. So we take all of these factors into consideration when we decide to embark on a policy initiative and whether or not we should take on an incentive-based or a regulatory-based approach.
That's really interesting. I'm curious also, just thinking about how you've engaged local government. What have you found to be a resonant framing? Is it the health message that resonates with local government, or another one? And do you have any tips for folks on the line who are in the early stages of this work, how to really craft messages to overcome potential concerns or opposition?
Yeah, I guess I would say a couple things. One is we use this process. We call it the model for social change, and it involves development of a broad-based coalition. And the coalition has to include certainly the populations that are impacted by these conditions, the physical conditions as well as the health conditions. And it includes folks who have some positions or some responsibility for making changes to the infrastructure. And I think it's important that all of these folks are included at the table. And then when you're engaging a broad-based cross-section, you can get input from everyone about what messages are going to resonate with the different audiences that you're going to have to interact with. But I think for the most part, in the work that we've been doing over the past decade, it seems to me that the message that resonates most, especially with the political agencies and the government agencies or the public agencies, is one that has economics as its kind of basis. So we find that what message resonates most is the economics. So when you can show the cost to government of what health care for preventive food-related disease amounts to government, that kind of stands out, and that gets everyone's attention. And then you can show how boosting the local economy through the expansion of food retail options, it would be to the benefit of local government. And that we found in our history of working on this, it has been the most appealing to local government. And so I think that your messaging should include those kinds of facts.
That's an incredibly helpful perspective. We had a question from the audience about organized political opposition, and I'm curious, with some of your more controversial policies, like the fast food moratorium, whether you had any organized opposition, and what tips you have about gaining the support of local government in that sort of political context.
So again, it's important to try to be as inclusive as possible in your coalition building, so that you can try to stave off as much opposition as possible, that you get everyone's perspective and everybody has a chance to weigh in and contribute to the discourse and the deliberation around the establishment or formulation of any policy. But that isn't always possible. We realize that. But we do try to include and to communicate with everybody from different points of view at different points in the process if they can't be included at the very outset. So we think when it's possible, to be sure to communicate with as many different perspectives along the way as you possibly can, to try to build the consensus that you're going to need to address any potential concerns or any potential opposition. And I guess I'll just leave it there for now.
That's great. I wanted to pass the baton for a moment to Lisa, who's going to facilitate the Q&A session with all of the panelists, and I'd love to hear multiple communities responding, and again also invite those of you who have had relevant experiences in your community to enter that in the chat box. Lisa?
Great, thank you. Thank you, Gwen, for just a really wonderful discussion about the different approaches that you've taken and the way you've strategized to really meet the needs of the particular policies that you're approaching. So I wanted to take a step back and have our guests from Baldwin Park speak to some of the questions that came up around kind of the next stages of the work that they're doing. So we heard from Christina, who described kind of the research that they've done around assessment and the fact that they're going to be doing an evaluation, hopefully to have some pre and post data on kind of how this approach has worked in their community. So we did have a question about whether or not that information will be available and when. And then also we had some questions about kind of looking to the future and trying to deepen this work and how we can really support stores in starting to shift their product mix from one that's based more on sales of things like cigarettes and alcohol and unhealthy foods to really starting to see more and more healthy foods being integrated into their sales. So anyone from Baldwin Park?
Sure, I can
start.
So I know, and I did see in addition to those questions, a lot of questions related to sustainability and kind of the next phase. And so just wanted to just share that I think one of the key things that we were able to develop was after presenting the data and findings to Council, we were able to develop a Healthy Corner Store Task Force that includes a City Council member, it includes corner store owner representatives, it includes community members that are part of the Healthy Corner Store Ambassador Program. These are residents that do weekly visits to the stores. It includes our nonprofit organization, as well as the group called Project Trust, which is working on tobacco cessation in the county of LA. And so by developing this task force, we've really developed kind of a more permanent group that's able to really now look at kind of what's the next phase of the program, what are some, as we discussed on this call, there's barriers to funding and there's limited funding. So what we're currently doing with this task force is developing proposals for private funders and groups such as California Fresh Works to develop long-term economic development strategies locally to support the next phase of this work by bringing in bringing in retailers, expanding the current program, which is currently a pilot program. And also we have been able to just most recently through our research and through our communications with city staff is develop a draft healthy corner store ordinance, which provides a floor area ratio for healthy products within the store. It helps to identify conditions and requirements for corner store owners. And so that is something that we are have drafted and have been working with Change Lab Solutions and other partners across the state to really find the best way to kind of implement this in stages. So this is something that we feel is really important to, we've heard of so many projects that have worked and put in so many resources to work with a particular corner store, and then 6 months later there's the owner is unable to sustain those changes. So we really wanted to ensure that this was something that not only had the buy-in of the city, but really provides a sustainable, it develops a sustainable policy that can really support these owners with making the changes, but really allows us to ensure that these changes to the store do not change within 6 months. So that's just kind of a little more info, kind of how we're looking to sustain the work. And as I mentioned, we do have a resident team that have been trained to visit the stores on a weekly basis. There's been a toolkit that's been developed for the owners to carry on the work within their stores, and they've received things such as polo shirts, grocery bags, recipe cards. So it's kind of like it's been an ongoing relationship to allow them to really brand and market their stores within the community for their growth. Just a little bit about kind of how we're sustaining the work.
Can I add a little to that? This is Gwen.
Of course.
So I know our experience has been working with first the Community Redevelopment Agency and now with the LA Food Policy Council, and then I guess that agency that's going to take over for the redevelopment agency. It certainly it isn't enough just to convert the stores. I guess the bottom line for the owners and the managers of those stores is that they don't lose money. And I know early on in the store conversion program and things that we've learned from was that there had to be some support given to the store owners for promotion of the changes that have been made, and then also working in conjunction with other folks to help educate consumers so that they are, because people get into habits regarding their shopping, and and you have to kind of help people understand that the store has changed some of the products, and then to kind of reorient them to the changes that have been made, so that then they get used to shopping at their local store and not having, as they've gotten used to going other places, so that the turnover of the product is a little bit quicker for the store owners, and that they feel as if they don't have to bring out the old products that they used to kind of promote and feature at the front of their stores, that they can now expect that they promote the healthier, fresher foods and have them more prominently displayed, and know that they will sell in a reasonable amount of time. So it's got to be a combination of strategies that are used when these stores are being converted, support for the remodeling and the promotion, and then the education of consumers so that they are reoriented in terms of their shopping habits as well.
That is an excellent point, and we did have a number of questions that were really geared towards this shift in thinking that needs to happen with a store owner in order to be able to participate, and really getting them on board with the idea of being able to run a successful business by selling healthier foods. And I wanted to ask all of you if whether or not you kind of observed, well, first of all, whether or not there's kind of a tipping point for stores as they enter into this work where they are able to sort of gradually change their product mix and then really see success come from selling healthier foods and being branded as a family and health and community serving store. And then also whether or not, actually, why don't we just start with that, whether or not you've actually been able to see that, and then the other question was whether or not that has actually filtered to other store owners, and if you've seen other store owners start to see these Healthy Corner Store programs and want to get involved.
I think that this is Councilwoman Marlene Garcia. Speaking of one particular corner store that's near to my house and now shopping there for my fresh fruits and vegetables, I do notice more customers coming into the store and purchasing these items, and I think it has a lot to do with the fact that they are fresh fruits and vegetables, and that is what attracts the consumers to these particular stores, because this market, corner store market, in the past really had deplorable choices in terms of fresh fruits and vegetables, and it was in a corner, it was dark, it was just really not appealing at all. And now when you walk in, there's a whole section of fresh fruits and vegetables, and while I was there, I noticed a few other people come in and purchase similar items. And so I think that, again, by continuing to assist them in advertising and spreading the word in every opportunity that we have as far as community events, I think for most folks in our city and these different corners of our community, the transportation, as I mentioned earlier, is a challenge for them. So a lot of our stay-at-home mothers rely on, again, just walking to the corner store and purchasing these types of items. And so, again, it's a reflection of the owner making these changes and providing, again, the fresh fruits and vegetables that are appealing to the consumer.
Great. And kind of along those lines, we had some questions about consumer demand. We had a question about whether or not either of the case studies had experience with kind of the nutrition education side of things and really trying to build demand for healthier products to ensure that these corner stores are successful. And then we had another question about kind of the shopping habits of lower income families in particular, who may be more likely to shop in wholesale grocery stores, big box stores where the prices can be lower. So kind of how do you sell the idea of shopping at local corner stores as a place to buy healthy food?
I think local corner stores provide a variety of, again, options, and the residents see that the fresh fruits and vegetables are that fresh. They will resort to shopping locally versus going to one of the larger supermarkets. I've seen that happen here in Baldwin Park. Christina, were you going to say something?
Yeah, I was actually going to also share that in the surveying process that we did with customers, we asked them specifically, where do you shop? List the various types of, is it a, for the majority of your produce, is it a big box store? Is it a wholesale produce? Is it a large supermarket? So we kind of took an inventory, but we also took an inventory of what their means of transportation was. And what we learned was that the majority of residents that we surveyed, their primary transportation was, by foot, and they really, made more frequent trips to the corner stores that were near their homes as opposed to shopping at these larger chains like Smart and Final and Vallarta. So that was one of the things that we discovered locally that was specific to our community. We also were able to really find out in terms of the, someone just asked on the call, Mark and a few people, that in terms of the demand, we really, I think one of the key things that we learned is that residents and patrons of those specific stores were the very ones that hosted or communicated with those owners because they themselves were the demand. They themselves were able to share the findings of what customers who were surveyed at that specific store wanted to see, and they were able to kind of really show the case that customers want to see a one-stop shop, a more comprehensive offering, and so that I think was one of the key things that we learned, that the owners were, were very open to their patrons, to their specific patrons, and the observations that their patrons shared, as opposed to us as an organization coming in and talking about why variety is important. They really heard it firsthand from their customers. I think that was a key thing, and that came through specifically by consumer surveys that they had saw specifically the surveys being done. They saw the information coming back to them. So it was something that was lasered, very specific information specifically about their store only. I think that was key.
And I think we're going to see an increase in the community support of these corner stores. Again, this is an effort of changing the entire environment of where our children and families live. Our next goal, and we just started this, is working with our local school district in terms of the food that they provide to the kids while they're at school, the cafeteria food. And this year we finally started a committee, and we're looking at the menus, and we're promoting more healthier food for our children. And I know some of the other cities have already delved into this, and I think that by educating the kids and informing them of what's healthier, and they're actually eating healthier items while they're at school, it's only going to spill over into the community. And so more and more children will learn about eating healthier foods in terms of apples and oranges and fruits and vegetables as well. So our anticipation is that it's going to increase, and so we've already set the platform for this particular area. So now, we're delving into the next area where we're hoping that the future generation of our community is going to be it's going to be ready for them. So it's going to be an easy step for them to take.
That's a great message, and it seems particularly relevant given that the program that you started was really focused on stores near schools. So it does seem like a great way of building on that, changing awareness of healthy food, particularly in youth. We had another question about kind of that process of implementation where you're really trying to work with the store owner in the initial stages and really help them overcome the idea of risk. So the question was specifically whether or not any of you have experience with providing subsidies or other types of support to reduce that risk, or whether or not kind of just the kind of hand-holding and stepping them through the process and all of that was enough to help them kind of take on the changes.
Well, I can say so this is Gwen, and with Community Health Councils, and I can say that from the support and the participation that we had with the corner store conversions, that it was a number of different levels of support provided to the store owners for the changeover. Some of it had to do with the technical assistance in making the store remodel, the repositioning of their store products so that the fresh foods are more prominent. And so there was some consultation with person who has experience as being a restaurateur and a store owner, and talking with them about what the store owners could do to make those changes. So in addition to that, there were some support given, financial support given in the remodeling of the store, and from inside as well as the exterior, so that folks had some help in the transformation of their store from the storefront to what it looked like inside. And then there was a bit of support given in terms of the promotion of this now transformed store, so that people in the neighborhood were made aware of the changes, and there may have been like an activity of some kind. I think one of the stores had like a tasting to help bring neighborhood residents into the store to let them know that something different is going on here that you want to know about and may want to participate in. So, and I know that they're going a little bit further because they wanted to give some technical support in terms of, and I think the development of a hub in which some of these local markets can pool their resources in the purchase of fresh foods, fresh whole produce from one source at a discounted rate, and I know that they're working to develop that as well. And so this was support given by, as I say, it's the now defunct Community Redevelopment Agency, but it being turned over to another agency that's going to replace them, so that this will continue.
Great. It sounds like that you really provided, you and your partners really provided a whole range of services kind of during that phase. Christina, do you have anything that you want to add to that in terms of kind of what you found has worked in your case when you're trying to get that store owner on board?
I think just, it's been kind of different layers. So one of the things that we did was breakfast with the mayor. I think that was really successful in really, bringing the business owners, to the table. They were very vested because the mayor was at the table and very interested in being a community partner, a business partner, and really having those, having that positive relationship with the city. So I think that's just another approach that we use to really solidify that, contact with the store owner. And as Marlene mentioned, the council member and mayor stopped into the stores, after the fact, and so that was just that ongoing. I think that relationship was just as strong as the residents, the patrons themselves, really visiting the stores on a weekly basis. I think just that collective and continual support from the city and from the community at large.
Great. Thanks so much. So we're actually just about out of time, so I'm just going to hand it over to Hannah to close up the webinar. And thank you again so much to our speakers for sharing all of your experiences and really kind of highlighting some of the best practices, challenges, and successes that you faced.
Great. Yes. Thank you so much to the speakers. It's really exciting to have these 4 different voices speaking from folks who are further along the path. And again, for those of you who are on the call for whom this is a new strategy and you're thinking and talking, it's I think just so satisfying to have people that are a little bit further along who can help delve in, even where you may not have all the answers to the questions. I think the how to do this that playbook is still being written, and we're all watching and learning so much from you. So thank you very much. I also want to again acknowledge and thank the Network for a Healthy California for creating the space for this conversation to happen this morning. For those of you who want to learn more about general plans, licensing, and zoning, I wanted to refer you to these tools that are available on our website, changelabsolutions.org. You can also find the licensing ordinance that we've just released on our website. And Christina has offered to share the resident survey, so you'll receive that in a follow-up email from us. Don't forget to sign up for our upcoming webinars at our website, and please don't hesitate to be in touch with either Lisa or myself if we can help you think through more about how this might apply in your community or follow up on any of the questions that were raised on this call. Thank you very much.